Now, shifting focus, the JN.1 COVID variant is now traveling from the south to the north. Delhi has reported its first case of COVID JN.1 amid a surge in variant cases. Gurugram has also issued an advisory directing hospitals to establish a dedicated isolation ward for COVID-19 patients. And even as overall cases remain rising, new JN.1 variants is causing a worry. A total of 109 cases of the JN.1 variant have been reported until the 26th of December. However, the authorities and experts have repeatedly called on citizens to not be alarmed, but to just remain vigilant. India has reported 77 new COVID cases yesterday in a continued declining trajectory in the past few days. However, as concerns remain, AIIMS Delhi has also set up a COVID-19 screening OPD in the emergency department. 12 beds will be kept separate for seriously ill patients. It will also start COVID testing for symptomatic patients.
दिल्ली के अंदर हमने RT-PCR टेस्टिंग जो है शुरू कर दी है और लगभग 250 से 400 RT-PCR टेस्ट हमारे यहाँ रोज़ हो रहे हैं। कल की रिपोर्ट के अंदर 2 पॉजिटिव टेस्ट कोविड के हमारे आए हैं और टोटल नंबर ऑफ पेशेंट जो हॉस्पिटलाइज हैं वो 4 से 5 हैं। कोई डेथ रिपोर्ट नहीं हुई है।
Now we're crossing over to my colleague Ishika to get us more details on this. Ishika, over to you.
Well, yes, certainly, as you rightly pointed out, that the first case of JN.1 variant has in fact now been, reported from the national capital, after which, Saurabh Bhardwaj, the health minister here, had said that there is nothing to panic among the people. In fact, the meetings with the hospitals are regularly being held to see as to what are the measures and how prepared they are. Let me also tell you that the AIIMS Delhi has already set up, a screening OPD for the COVID-19 patients in the emergency ward. In fact, 12 separate beds have also been allotted for the seriously ill patients. Yesterday also, if we talk about, the AIIMS Delhi head had in fact held a meeting with all the medical health as to, what are the measures that could be taken and what areas that can be designated for the positive cases that come in. So certainly we have earlier also seen how Saurabh Bhardwaj, the health minister here, had also directed all of the hospitals in the national capital to test anyone coming with flu-like symptoms here for the COVID-19 test. So, the government continues to say that there is nothing to panic here, but the experts, on the other hand, they continue to say that certainly when you see all across the country when the cases are rising, it is only, responsible for the people that as and when the cases start increasing, they start doing, their normal COVID protocols like hand sanitization and wearing a mask. Over to you.
And how worried does everybody need to be about the new variant? Because the general perspective of it is that this is a more mild variant.
Well, certainly, that is what the experts go on to say, that this is a very mild variant. And in fact, if we talk about Delhi itself, the number of beds that are, that are being used for the COVID-19 patients is also very low. That is why the government on, various occasions continue to say that there is nothing to panic here. But we have seen how, the cases of JN.1 variant has only risen in the neighboring states. If we talk about, Maharashtra, there also the cases have increased. And in fact, certainly there are other states also where these cases continue to rise. That is why, the government all across the country, all the state governments, the union government, that is on high alert. But the experts, on the other hand, they continue to say that this is certainly a mild variant and there's nothing to panic. But also, there is a need to follow the normal COVID protocols. Over to you.
All right, Ishika, thank you so much for joining us and bringing us those details. We'll continue to return to you for more updates.